Good evening. I'm Harold Holzer, director of the Roosevelt House, and on behalf of Jennifer Rabb, president of Hunter College, it's a pleasure to welcome you to a symposium created by Ruth Finkelstein for Hunter's Brookdale Center on Healthy Aging, and it's called Older Adults in the Plague Year, Times of Resistance and Resilience. The program arrives at a perfect time because the month of May is Older Americans Month. If we were together at the house, as we will be again soon, I would now be inviting you upstairs to the library where Franklin Roosevelt presided over the transition between his election in November 1932 and his inauguration in March 1933. Here, Roosevelt and his key advisors built the foundational building blocks of the New Deal. And here, the New York State Labor Commissioner, Frances Perkins, arrived one day in February to be interviewed for the job of United States Secretary of Labor. It was a big moment. If chosen, she would become the first woman to serve in any presidential cabinet. Well, if the president-elect thought Ms. Perkins would come begging for her position, he quickly learned otherwise. Ms. Perkins told him that she would join his team in Washington only on the condition that he would support a minimum wage, maximum hours, and a program to provide guaranteed income for older Americans, the program that became known as Social Security. So that historic idea and that history altering precedent unfolded right here at Roosevelt House. And of course, it inspires us to this day. I think it also inspires Brookdale, which Ruth so ably leads, which has been working to improve the lives of older adults through research, professional development, and advancements in policy and practice since 1974. The center's work is animated by the belief that aging must be framed not as a disease, but as another stage in what's called the life course. Its experts know that the way we age is influenced by the way we live, that a good old age is a life with purpose and meaning, social engagement, a positive attitude toward aging and life, sufficient financial resources, and physical and mental wellness, which is a tough thing to achieve in this age of COVID-19. Brookdale's research focuses on problems, but in each case, the picture that emerges is one of strength. In contrast to the image that depicts older people as victims, whether it's of COVID, isolation, misinformation, discrimination, or violence, Ruth tells us that this evening's program is designed to disrupt that cliched picture. Instead, you will hear scholars describe older adults who are resourceful, resilient, and resistant. Hopefully, you will come away knowing that what we do as individuals, communities, and policymakers to promote these characteristics does indeed extend and improve the life course. So with that in mind, let me introduce this distinguished panel, together, by the way, responsible for hundreds of scholarly articles that have changed how we study, regard, and support the aging. We welcome Mark Brennan Ing, Director of Research and Evaluation at the Brookdale Center, whose research focuses on the psychosocial issues affecting persons with HIV and on older sexual minority and gender diverse adults. Welcome to Keith Chan, a new assistant professor at the Silverman School of Social Work. In addition to serving as a fellow on the House Committee on Ways and Means, he studies the social determinants of physical and mental health for vulnerable populations, including older adults. Christian Gonzalez Rivera is the Director of Strategic Policy Initiatives at the Brookdale Center, where he takes findings from academic research and translates them into policy and practice. He's an urban planner by training, and he's dedicated his career to expanding opportunities for marginalized communities. He's no stranger to Roosevelt House, having served with us as a Grove leader. And Elizabeth Combs serves as both Associate Provost for Research at Hunter College and is the Rudin Professor and Associate Dean for Research at the Hunter School of Nursing. Her work focuses on urban community health, especially the engagement of underrepresented communities. The panel will be moderated by Brookdale's own director, Ruth Finkelstein, who is also a professor of urban public health at Hunter and serves as well on the faculty and on the Faculty Policy and Curriculum Committee of the Public Policy Program here at Roosevelt House. Ruth is a nationally recognized leader in the global movements toward age-friendly communities and age-friendly universities. She has done a number of programs at Roosevelt House, and it is a genuine pleasure to welcome her back at a moment of both precarity and opportunity. I feel a lot better about aging myself with Ruth at Hunter College. With that, it's a pleasure to hand the mic over to my colleague, Ruth Finkelstein.
Thank you so much, Harold. Those are very kind words and kind of inspiring and a little humbling also. I'd like to welcome the many friends and family who I see in the audience, that is by seeing that your name and blob, and I look so forward to seeing you for real in the very near future, hopefully at Roosevelt House, where we can go back up to the library and be amazed at the treasures therein, as I am every single time I come in. I'd like to welcome you to this symposium honoring Older Americans Month, and to make clear to you that the people you'll hear from this evening are just a sampling of the scholars and researchers in the Hunter community who are contributing actively to a new understanding of aging and the life course. And we look forward to bringing you many more if we don't make a complete hash of this one. So, guys, don't mess it up. We need to hear from everybody. Um, so, it gives me great pleasure to bring you. I'm not going to reintroduce all the panelists. You're going to be relieved to know. But I am going to say that together, I hope we paint for you a picture of um, older adults during this time that shows our collective strength and resilience, and then allows us to interrogate what is necessary to allow everyone across their life course to be able to demonstrate and display that kind of strength. Um, I'm going to ask that you put your thoughts into the Q&A as we go along. We're not really where we can ignore them. No, we're not really going to have a designated Q&A session, but we will be monitoring that, and we'll use it to inform the discussion when panelists turn to one another, and I moderate some questions at the end. So I'm not going to say if there's any questions, we'll go on, because how would you say if there were? So instead, um, we'll go on. And our first speaker, um, from whom we are so honored to hear, is Mark Brennan Ing.
Thank you, Ruth. Let me just get my slides up here. So this evening, I'm going to be talking to you about crisis competence, which is actually a resilience that gets better as we get older, as many things do. So what is crisis competence? Excuse my shameless self-promotion here, but you only get in the New York Times so many times in your life. And I was interviewed by John Leland for an article he did in January about how older adults were doing during the pandemic. And he wrote this and quoted me, and I don't think I could do better than the way I articulated it here. He wrote, "A surprise of the pandemic has been how well many older adults have adapted to the restrictions." And I said, there's crisis competence. As we get older, we get the sense that we are going to be able to handle it because we've been able to handle challenges in the past. You know, you get past it, these things happen, but there's an end to it, and there's a life after that. And I really like this phrase, crisis competence, but I was not the one who came up with it. The person who came up with it was my friend and colleague, Doug Kimmel, who used to be at City College. And he coined this phrase in 1978 to explain the paradox of why older LGBTQ people had higher levels of well-being compared to younger LGBTQ people, despite having gone through many more decades of discrimination and oppression. And remember, picture 1978. So things were really not as open and accepting of people who were diverse in terms of sexual orientation and gender diversity then. And in this article, he said, he was talking about the coming out process as the basis of crisis competence. And he said, it's possible that this crisis early in the gay person's adult life, one that can involve extensive family disruption, intense feelings, and sometimes alienation from the family, may be one of the most significant a gay person will face. Once resolved, it may provide a perspective on major life crises and a sense of crisis competence that buffers the person against later crises. And this is a really important idea when we think about how we cope and adapt to different life challenges over the life course. So I want to show you a couple examples of crisis competence from my own work on older people with HIV around HIV stigma. So this was a study we did way back in 2009, and we looked at self-perceived HIV stigma as a function of both sexual orientation and gender. And HIV stigma is rooted in all the stigmas that are associated with groups at greatest risk for infection, such as gay and bisexual men, sex workers, or injection drug users. And what we're looking at here is how the most stigmatized groups and the most stigmatized identities do. And you can see that overall, people who are LGBT tend to do better than people who are heterosexual. But we also find, you know, if you look right here at women who were lesbian or bisexual who had HIV, they had the lowest perceived stigma. So not only are they dealing with a gay identity, but also sexism because they're women. We see that within these gender groups that people who identified as a sexual minority did better than people who were heterosexual. And the group that did worst was actually heterosexual men, the group we would associate with having the most privilege. It may be that these men are more stigmatized by an HIV diagnosis because they fear that people are going to assume they're gay or assume that they're an intravenous drug users. And gay and bisexual men who've experienced the sexual orientation stigma prior to their HIV diagnosis don't feel as stigmatized by HIV. When we looked at some other data, which I'm not showing here, about disclosing your HIV status to other people, we also found that sexual minorities were significantly more likely to disclose HIV status than heterosexuals. So that's another indicator of crisis competence. From the same study, we did an analysis. I did it with my good colleague and friend Kristen Porter, looking at how spirituality and complementary and integrative health use buffered the effects of HIV stigma on psychological well-being. So complementary and integrative health, a lot of people know that as CAM, complementary and alternative medicine. So really the same thing. And what we found here was that spirituality had a stronger buffering effect for the older gay and bisexual men compared to the heterosexual men. And so we felt, again, that this was a demonstration of crisis competence in coping with HIV stigma, perhaps from overcoming past stigmas around sexual orientation. But there are other examples, and I want to bring it now to the present time in the pandemic. And this was some research that the CDC did looking at different mental health indicators by age group. So what they're looking at here was anxiety, depression, and trauma and stress disorders. And you can see kind of across the board, the older people did better in terms of these mental health indicators than did their younger counterparts. And I think we can also attribute this to this crisis competence and not being as disrupted in terms of their well-being due to the pandemic. And this was a really good quote from Helen Leveretsky, a professor in residence of psychiatry and behavioral health sciences at the Jane and Terry Semel Institute for Neuroscience and Human Behavior at UCLA. And she was talking here about older adults with depression. And she said, we thought they would be more vulnerable to the stress of COVID because they are, by CDC's definition, the most vulnerable population. But what we learned is that older adults with depression can be resilient. They told us that coping with chronic depression taught them to be resilient. So I think the evidence is pretty strong here. So I think that's the good news. Here's my contact information, but I think the good news here is older adults are doing well. They're resilient. They have a lot of coping resources to deal with the pandemic. And we should be optimistic and think of the best ways we can support them as we get through this. Thank you very much.
Thank you so much, Mark. We have members of the audience that are so interested in this that they want to know if the slides will be available. And the answer is yes. We will be posting both a recording of this evening and slides that the speakers make available on brookdale.org, which is shockingly Brookdale's website. And I now, they'll turn up in a couple other places also, which by the end of this evening, I'll give you other spots to find them, but why not go to brookdale.org? It's now my pleasure to introduce Professor Keith Chan, who I'm just starting to get to know. I'm so pleased that Silberman was able to recruit him to join their faculty, and I'm excited to hear what he'll speak with us about this evening.
Sure. Just want to start by thanking Dr. Ruth Finkelstein for inviting me to come and talk with this honor group of panelists. There's a rich tradition of policy work and social justice within the Roosevelt House, and I'm just delighted and also honored to be a part of this discussion currently with everybody. So today's topic that I wanted to speak about, and let me share my slides, is on speaking out against anti-Asian racism and violence against older adults. A lot of this has to do with my own perspective, looking at it from the lens of social justice, but also in terms of policy and legislative change, oftentimes from grassroots action, because of an elevation of awareness around certain issues. So today I'll talk a little bit about framing the issue on anti-Asian racism, working towards social justice, and then also solutions as gerontological scholars and educators. First, I want to be able to talk a little bit about my personal and professional experiences as an Asian American. I was born in Hong Kong. I immigrated with my family to the United States when I was 9 years old to New York City. And so through a number of different opportunities, through this program, Prefer Prep, I was placed into a private school and scholarship. And then I became a first generation college student on a full scholarship at Brown University. After I graduated, I worked in Massachusetts with people with serious mental illness in communities of color. I went back to school to get my MSW at Boston College, and currently I'm at Hunter College at the Silberman School of Social Work. So I'm just really honored to be here and to be amongst such honored company. So in terms of first talking a little bit about framing the issue of anti-Asian racism, AAPI, also known as APIDA, AANHPI, there are many different acronyms. So today I'll just be using primarily Asian American Pacific Islander, AAPI. We're a very diverse group with more than 30 distinct ethnic groups and also speaking more than 100 languages. Despite this, though, there is in fact a broader historical context which points to structural racism and violence that continue to shape our everyday lives in the United States. So there's a history of anti-Asian racism since the 19th century. So this is not new, what we're seeing right now. It's rooted very deeply in post-colonialism, and that Asians were racially distinct aliens ineligible for citizenship in the 19th century, also referred to as the Yellow Peril. There's another narrative, and that is of the Asian American movement, which really roughly is about 1960s to 1970s, based on anti-war and anti-imperialism, where there became this Asian American identity, which became a collective identity motivated primarily by social justice. And this was in solidarity with the Black Power movements in the 1960s and the civil rights. Beginning in the late 1960s, however, Asians were referred to controversially as the model minority. And this was used to justify inadequate access and low utilization of social and health-related services among Asians. And perhaps more insidiously, the model minority narrative reifies claims of egalitarianism as a triumph over exclusions while also justifying social differences and inequalities. And this is part of an article I published last year. We talked a lot about acculturation and discrimination among Asian older adults. A lot of what we're seeing in terms of violence is directed at Asian older adults, which really highlights the conditional minority status of Asian Americans in AAPI. Asians are highly diverse in ethnic group identification, pre and post-migratory circumstances, health outcomes, income levels, but also perspectives on the immigrant identity and also the immigrant success story. This is part of this an interview I gave to Argentum, which came out, I believe, earlier this month, talking about what are some of the things that we want to look for and consider when we think about the immigrant success story. And that's actually something to celebrate, because the immigrant success story, just like the working class success story and the minority success story, is in fact a good and positive thing. However, we also have to hold space for the realities of those who are still experiencing racism and injustice and inequality. And as we're talking about this, there's a framework that I use in terms of looking at some of these experiences, and that's the intersection of race, ethnicity, age, gender, social class, and immigration status, where all of those things working together ultimately can have a compounding or weathering effects when we look at different identities and marginalized identities and statuses. So what can we do in terms of working towards social justice? Because I really do want this to really be a discussion about resilience as well. What are some of the possible solutions? What are some of the things that we want to do? There's been a call to action, and certainly this has been very much centered also around the community at Hunter, in terms of the Hunter College Asian American Studies Center. I know Dr. Louie had also given a talk about this topic. There's also work that's happening with Hunter College Anapisi Project, the HCAP, as well as the stuff that I've been doing in my capacity as the Vice President of the Asian and Pacific Islander Social Worker Educators Association, as well as my role as a member in the Association for Gerontological Education and Social Work. Part of the challenge, though, is how do we acknowledge the differences, but then also finding common ground to move the social justice agenda? I believe it's very important to also have allyship with Black Lives Matter. That's in fact part of the history of the Asian American movement from the 1960s. Also, it's very important to learn to how to build on the language and actions to address anti-Asian racism. Because part of the challenge has been that there hasn't really been a lot of language and not a lot of speaking out. What are some of the strategies that we can use to disseminate to our base? Because let's be honest, oftentimes the media attention on issues don't oftentimes last very long. Part of it is maintaining that momentum. And then part of it is as well tapping into the inherent strengths in families and communities, because there are in fact a lot of communities, a lot of strength in communities and families. Part of the research I found last year in looking at AAPI older adults is that those who experience discrimination are also more likely to become citizens, which means that this is an opportunity to mobilize the vote among AAPI older adults. Older adults also can be advocating for legislative and policy action at the federal, state, and local levels. I think a big, we're seeing, so today, right, I was just keeping an eye on the news and I saw that the Stop Asian Hate bill was passed in Congress and it's heading to President Biden's office. I think that's a really good first step, but I also believe that what's important is to keep that from even happening in the first place. So a lot of the challenge then is when we're talking about an older adult population who in fact want to advocate for social justice, who are citizens, who can in fact mobilize around issues that people care about, is to find ways to provide assistance to navigate complicated medical and legal systems, because that's really a big part of the challenge. Supporting Asian older adults in community settings so that they can actually do some of this work. And then finding ways to enhance intergenerational relationships, because that's also part of the resiliency and also the inherent strength of older adults, is that there's a focus and an emphasis on intergenerational relationships, where there's in fact a reciprocity in terms of giving back. And then also as community advocates, finding ways for empowerment without oppression, and then also addressing the needs and promote the resiliency of AAPI older adults. As a scholar and an educator, I always think a lot about this. What are some of the ways that we can address individual and structural change through research, teaching, and social justice advocacy? As scholars and researchers working with older adults, leaning into our work on social justice. And then also as educators, there's also a need to work in partnership with AAPI older adults to meaningfully connect the experiences of post-racial and also post-colonial identities, and to engage our students in social justice from a position of cultural awareness and global membership. So I think a big part of the task, in fact, is how do we tell the story and draw the map so that we can navigate through this, but also have some sort of a guidepost as to where to go next. And something I like to emphasize is that when we're working towards social justice, the tiger can work together with the panther. And so that's really it for me. I also like to thank the Silberman School of Social Work, my dean, Mary Kavanaugh, also my involvement with the Asian Resource Center for Minority Aging Research, and then the Congressional Fellowship through the Health and Aging Policy Fellow Program, and also the generosity of the folks at the U.S. House Committee on Ways and Means, who is really teaching me a lot about how policy works and legislation works in terms of supporting populations who are in need. So thank you very much.
Thank you, Professor. I look forward to integrating these ideas in the discussion, but not till we get some more of them. So it's my pleasure to introduce the next speaker, Professor Elizabeth Cohn, who is not just a professor of nursing, but also my friend, and brings interesting evidence from earlier on in the pandemic. Thanks, Liz.
Thank you. So I'm gonna, that was great, Keith. Thank you so much, and very thoughtful work as well. So I'm gonna share a little bit of some of the science that we've seen through this COVID from a study that I did with some colleagues at Columbia. And it's a part of a larger study that looked at 800 Blacks, African Americans, and Hispanic, low income minority patients with a specific type of heart failure. So they would be considered a vulnerable population during COVID. And this is an interim report from our NIH-funded study that looked at how they were coping. We were really concerned for this population of patients because they would be deemed to be at the highest risk with multiple comorbid conditions and complicating factors. And at the same time, there was little that we could do. So we led a team just to make sure, we really started by just wanting to check in with people and make sure that they were okay. And then as the CDC recommendations rolled out, this was before the vaccine, as the CDC recommendations rolled out, we were wondering and hopeful that they could mitigate the COVID disease through what was being recommended. So just first, it was funded by NIH through a sub-study. So what the aim was here was actually just to talk. We were placing calls to people to make sure that they were still okay, and then we wanted to explore with them whether they could use the mitigation strategies that the CDC was recommending, which at the time was masking, hand washing, social distancing, and hand sanitizer. And it was before we had a vaccine, so all we had was the mitigation measures, and things were in pretty short supply. There was a lot of masks were hard to get, hand sanitizer was hard to get, so we actually sent people small kits with masks and hand sanitizer and other things, and bleach wipes. But we still had concerns about whether they would do it. So just to say that it's a sub-study of a larger study, but I'm going to talk about the large study has 218 people in it, but we had about half of that, 102 in our sub-study. And you can see that they are mostly male, mostly Black, although there are some Hispanic, and in the study, they ranged from 60 to 92. So an older adult population. First, we wanted to know, where do you get your guidelines? Like, where are you getting the news? How do you know what to do? And so 90% of this population, this is in New York and Boston, 90% of this population got their COVID information from local news stations like 1010 Wins and 880. That seemed to be the best way to get, people could choose more than one of these, but as you could see by far, almost 90% of them were getting their CDC information from their local news. 75% got them from local elected officials, and in New York anyway, our governor was broadcasting at the time, you may recall, was broadcasting the COVID update. Governor Cuomo was broadcasting the COVID update daily, and people were following that. 70% from doctors, about 75% from cable news overall, and about 50% of them chose 7 sources or more to get their information. So they were really triangulating the news that they were getting. They weren't just taking it from one source, which I think people sometimes think we are, but they were listening to the news, plus reading a newspaper, plus checking in with the mayor. So that was good. And then what did they do? What did they do with the information? So what we found was people were aware of the community mitigation measures, and for the most part, they were readily able to follow them. They reported wearing masks, hand washing, 92%, avoiding social contact, and using hand sanitizer. About 50% of the 102 people were able to implement at least 8 of the measures that were recommended at the time. And some of the recommendations have changed, right? Like, we don't really wipe down packages or groceries, things like that. So they were informed, and they were able to carry out the mitigation measures, which is fantastic. So we were worried about how they stayed connected and how they stayed, and whether there was still a social connectivity. So this is probably an expected result, but I think it's good to think about. About 75% of them stayed connected by talking on the phone, a few less texting, video calls, and very few people were meeting in public or at somebody's house. So Again, they were really great. 75% of them felt like they were still quite connected to their friends and family, but they were doing it safely. Then I think, again, there's not a surprise here, but it's just interesting to see about 25% each for in the change of daily routines, no change, mild change, moderate change, or severe. So it went about a quarter all the way around about people's changing in their routines. And household income, about a third had changes in their household income, and all of those people did have a drop in their household income. So, that's something to consider and worry about. We wanted to know how they were doing on their mental health and their medical health. So people were more stressed. I saw somebody put in the chat earlier on that they were stressed. This pandemic stressed them, and we did see that. We did see that about more than half had mild to severe individual stress, 27% reported household stress, and 12% switched to telehealth for mental health issues. And, I think of concern is 6% had moderate to severe restrictions on getting the mental health care that they felt like they needed and wanted. So that is something that we need to work on, I think, in general. Only about 22% had moderate to severe changes with loss of contact in family or friends, and everybody else had lost some contact, but was able to, as you can see, a majority of the people were able to have no change or mild changes that were related to social distancing and amending their visits. So there's many more slides, and I'm happy to talk through many of them if people remain interested, and we can certainly take that up in the Q&A. But we just want to say that overall, despite this kind of imaginary thing you see with the hands coming together across the glass, most of our participants in this study, which again would be low-income older adults with multiple chronic conditions, most of them understood and could follow the CDC mitigation guidelines, at least 8 of the 10. Despite that, we did have 10 people of the 100 that developed COVID. So we are looking into, since we think that they took such careful mitigation, we are looking into how those 10 people and maybe what happened there. People found ways to stay connected reasonably well, despite that kind of depiction that you think about. Medical needs, which I didn't show, were primarily met. People were able to either use telehealth or have a doctor's visit when necessary. Medical needs were primarily met, but the mental health needs were definitely still lacking. As I said, most of our groups in Boston and New York used local radio stations and elected officials. For our next steps, we want to think about if there's changes now that the vaccine is available, how is that impacting it? We'll update the actual infections now that we can start to test people. There was a lot of activities that moved online, conversations, salons, and more. And a lot of the people that participated in those groups found that the extended reach for libraries and other online programming was actually a gift to them, that they felt really good and had actually greater access to some of the programming than they had previously. So that's kind of a silver lining and a lesson learned that the programs, we can include more people from further away if we continue to have some online presence. For further analysis, we want to look at what's the same and different in Boston, map it to income and the neighborhood atlas to see if maybe there's neighborhood discrepancies there. We think that maybe the 10 people who developed COVID perhaps were living with an essential worker or had a caregiver coming in to care for them. And so maybe that is the reason that the COVID developed. So we'll look into that a little bit more. We're delighted to say that people were generally well informed and triangulated their information from multiple sources. They understood and were able to enact most of the recommendations. It's self-report, of course, but But we thought that was really promising. And, it is a concern that despite understanding and taking appropriate measures, some people went on to develop COVID. So we will take another closer look at that. We've got in English and Spanish. So we feel like that's a real strength of this so that we can try to better understand a number of the different cultures. We describe risk mitigation in an at-risk population, and we're also going to take a deeper dive into understanding what these results mean. And the limitations are just that the numbers are small, and this is an interim report. And thank you very much. And I will stop there.
Thank you so much, Liz. I, of course, am trying to read the Q&A and fumbling around to unmute. Thank you for that really interesting and stimulating report. We've got lots of people asking in the Q&A about residents of nursing homes and in
sorry, and these were all community dwelling. I should have said that. This whole study was community dwelling older adults. This is not a nursing home study. I'm sorry, thank you for that.
Yes, and we'll talk more about some of the similarities and differences and various dimensions of intersectionality and the observations that we've made, but not until we've made all the observations. And so our next speaker is Kristen Gonzalez Rivera, who will address directly the most recent question asked, which was in fact about technology. Thanks.
Hello, everybody. Thank you very much, Ruth, for inviting me to speak, and thanks to all of you for coming to hear us speak about this. So I hope you're all doing well. So again, my name is Kristen Gonzalez Rivera, and I work with Ruth at Brookdale. And I'd like to talk about tech access in particular. I mean, it's I think one thing that the pandemic has really shown us is the importance of knowing how to use the internet. And chances are that many of us who are attending this forum right now have been among the lucky ones, who have been able to mitigate at least part of our lives during the pandemic through the internet. Whether that's socializing or meeting basic needs like grocery shopping, telemedicine appointments, as we were just discussing. In essence, I mean, it's like chances are that access to good internet or meaningful access to the internet really allowed us to maintain more of a sense of agency and independence when so much of our world got shut down. But the fact is that there are 400,000 older New Yorkers, and that is, New Yorkers age 60 and above, who lack internet access at home. That's 1 out of every 3 New Yorkers age 60 and above. And internet use, in terms of who these people are, who this 400,000 are, internet access at home is strongly associated with 3 main factors, according to the research that we did on this. I mean, one is age, certainly. I mean, it's like what age cohort they're in. But importantly, it's also not just age, it's also the level of formal education that they were able to achieve and their income. So all of these 3 characteristics of a person sort of work in tandem and intersectionally, to really describe, I mean, it's like whether a person is likely to have access to the internet at home or not. So let's look at the first one first. And that is that internet access at home does drop off at higher age cohorts, as you can see here. As you can see, more than 9 out of 10 people in their 50s and younger have access to internet at home, but fewer than half of people in their 90s do. So you can see what the range is. But there's a big difference in access, even within people of similar ages, depending on their level of formal education. And so we can look at that here. As you can see, 89% of older adults with a bachelor's degree have internet at home, versus you can see, I mean, with this chart that's here, that people who are younger are more likely to are also likely to have internet access at home. But even within the same cohorts, there's a big difference along the spectrum of education. So it's not just age that explains this, it's also education. And importantly, it's not just that the level of formal education among people of the same age cohort that makes a big influence, but also between different cohorts. And so that's what we see here. So as you can see, today's 20-something New Yorkers are on average more educated than today's older cohorts. You can see that by age 25 to 29, just a quarter of New Yorkers have a high school degree or less. When people in their 90s, about 3/4 did not go beyond high school. And more than half of New Yorkers who are younger than 40 have a college degree or more. So this shows that to the extent to which education is related to internet access, the lower average levels of formal education among the older cohorts make a big difference here. So it's not just the age, it's also the mix of levels of formal education among these different cohorts. The second biggest factor is income, as we were talking before, and you can see that similar to the to formal education, the associations are similar, where you have younger, wealthier people are more likely to have internet access at home, while the opposite, people who are older and poorer are less likely, right? So once again, we see that it's not just a clean cut among older people have less access to the internet. Income also plays a factor, though in this case, education plays an even stronger factor. And so, excuse me, what accounts for these differences in terms of internet access across education and income? The most likely explanation, I mean, it's like that we were able to see in the research that we did on this, is that people with more education and jobs that paid more throughout their lives were most likely to have had earlier access to the internet. And therefore, they were more likely to see the internet as a useful tool in their lives. And to sort of illustrate, I mean, it's like what that looks like. I mean, sort of dynamically over time, I want to show you this. So, I mean, it's like this is a chart that illustrates the share of people in the United States since 1990 who use the internet. In this case, before we were looking at internet access at home. In this chart, we're seeing use of the internet, right? And you can see that in 1990, almost nobody was using the internet. And by the end of the century, so by around 2000, we can see that about a third of Americans were using the internet, right? I mean, maybe 1999 here, about a third of Americans were using the internet. But crucially, it wasn't until 2002 that half of Americans started using the internet. And today, of course, it's close to 90%. So what this shows is that, I mean, it's like sometimes it feels like the internet's been around forever, right? I mean, it's like, but what this really shows is that people who are older today were at different stages of their lives when the United States reached that milestone of 50% internet adoption. And so 2002 was about 20 years ago. So it means that people in their 80s today were in their 60s in 2002. People in their 70s were in their 50s back then, so forth and so on. People in their 50s today were in their 30s back then. So from age cohorts from millennials to older, the internet likely came into their lives in the context of school or work, right? I mean, it's like that was the likely place. I mean, it's like where the internet first entered people's lives. But older cohorts who are likely to have been older when they first used the internet were likely to have already been older if they used it at all. So I mean, it's like that's sort of the key dynamic here. So, example, I mean, it's like if you were in your 60s, when the internet likely came into your workplace, and if you were older, you probably didn't encounter the internet at all in those contexts. And so, importantly, I mean, it's like even among people of the same cohort, not everyone encountered the internet in these settings all at once. Right? It's not like all 40-year-olds, all 30-year-olds, et cetera. I mean, it's like encounter at the same time, which is another piece that's important. And so in terms of what explains some of those dynamics, people with more years of education likely had more opportunity to encounter it at work or at school. And if you were at any age, and you worked in a white collar job or one that requires more formal education, you are more likely to have you are more likely to have encountered the internet rather than somebody who had less education, perhaps worked a blue collar job, that didn't get the internet until much later, right? So what this all means is that social class, for which education, level of formal education is a useful policy, is a stronger predictor of access to the internet at home than age or income alone, right? And the big takeaway from all of this is that getting that unconnected 1/3 of older adults online requires investing in the education programs in two pieces. I mean, this is important to make this distinction. The education programs that show unconnected adults how the internet can improve their quality of life, right? Because if you're 80, 90 years old, chances are you have been living your life in a completely different way that didn't involve the internet. So basically, the operative factor here is, well, how would the internet improve my life at this point compared to the way that I've always been doing things, right? So that's the operative question here. So education to say, what is it that you want to do in your life? How can the internet help, right? So starting with that question. And the second piece of investment is, of course, the skills to be able to use the internet, right? And there's an important distinction there because you can't jump right into, okay, let me show you how to turn this thing on. Because the first question is why? Why should I add this to my life right now? How can it make a material difference? So those are two very important pieces. And we developed this little sort of diagram here to sort of as a definition of what does it mean to have meaningful access to the internet, right? And so we talked about training education. We talked about ongoing support, I mean, which is extremely important as well. I mean, it's like if you run into trouble, who do you turn to for help? Those are two crucially important pieces, in particular for getting older adults connected, right? And the reason I mention this is because most interventions aimed at closing the digital divide stop at the first two suitable devices and an adequate that subsidizes devices or a connection, which of course, I mean, might work for school kids who, need access to the internet to do their homework, but it's not sufficient for getting older adults online. I mean, it's like in order to do that, you really need those other two pieces. So the major takeaway from our research here, it's very sort of policy oriented research in this case, is really that increasing the resilience of older adults is that all investments in closing the digital divide, all of them, need to take older adults into account by investing in the education and training programs and the support programs that they'll need to get online. So that's our big takeaway. No intervention around the digital divide without taking older adults into account in this way. All right, so thank you.
Thank you very much. Okay, so now is the moment for all the amazing points that have been coming up in the Q&A to start to be reflected in the discussion. I'm hoping that my panelists who have an opportunity to ask one another questions will be generous in your time by taking up some of the issues that audience members have been bringing forward, since they are unlikely to have the time to do so themselves. So I'm hoping that you share and open it at the moment to the panelists to speak with each other about issues that arose for you or your audience as you listen to one another. Anyone want to start? This was not scripted.
I really like Joyce's question, so maybe we can put that out to the panel in general, which is, did any of our research look at the impact of negative stereotypes of older adults during the pandemic from the older adults' point of view, of course. And so I'd like to, kind of we'll put it out to everyone and maybe think about it together as a group.
Great. So people want to take up that subject?
I guess I wonder, like, if as somebody who's getting older myself, I think I don't know if you can. I'm wondering for this panel, maybe even for our listeners, do you feel older inside, or do we always feel younger inside? And so therefore, I think the stereotypes, we didn't find that they panned out, right? Like, we didn't, people were, visiting, being supported. And I mean, some people, we all hit a wall at one point or another as part of it. But for the most part, I think people fared well. And so I wonder what other people think.
I don't think we have any specific research on that question on this panel. But of course, we know that the sort of seminal research on the topic suggests that one of the biggest sort of predictors to stereotype embodiment, that is feeling the stereotyping against you, is being surrounded with it. It's one of those self-fulfilling prophecies. It's a positive feedback loop. And so I think that even though we acknowledge fully that many people's individual experiences of this pandemic were extremely challenging. I mean, my God, our city, our nation, and the whole world has been challenged enormously. We felt that an important contribution to our understanding of aging is to bring forward the strengths of aging in the context of crisis. And that's partly to explicitly address ageism, but it's also, and this is, I want to bring it back to you and to your questions. It's also that our experiences across our lives contribute to what we bring, what we are as older adults. So experiences of prejudice, of discrimination, of violence, of lack of access to opportunity across our lives contribute to our experiences of aging. Now, go back to you, the end of the sermon, and back to your questions of one another. Sorry.
Excuse me. This, as you mentioned, Ruth, we're not currently doing any research on this, but it does reflect some of the conversations we've had amongst ourselves at Brookdale about really what the impact is of characterizing all older adults as being vulnerable and not recognizing that many older adults were in fact actively contributing to meet the needs of other people during the pandemic. And, you know, we were going along with this narrative. Of course, the the sickness and mortality in the older adult groups was much higher than younger groups, and that helped feed into that. But that didn't characterize everybody, and it is really also pointed out with the social mitigation how much older people contribute in terms of volunteer work in our society, and what happens when that resource is no longer there.
Thank you. Kristen or Keith, did you have questions to pose before I pose one to all of you?
Sure. I just wanted to kind of briefly comment on that around negative stereotypes. Because it is tied to a lot of the issues I look at in terms of Asian older adults, that there's this perception of physical frailty, right? Which is part of the reason why I think oftentimes we're seeing in the news that Asian older adults are being targeted. And it kind of ties into also this idea of disablement, right? That ultimately it's really the gap between personal capability and also resources in the environment. And I think there are certain issues right now in terms of environmental resources, which ultimately there's been a lot of community action and also resilience in terms of meeting, right? And a lot of this, in fact, is motivated by older adults. I'm really thinking a lot about some of the work that I've been doing with some of the community advocates, like, for example, the Home Press Community Center, which is a Chinese American older adults community center based in Brooklyn, New York. and the campaigns that's took place that's taking place when the Asian woman who was set on fire, she ended up speaking out and becoming really kind of like standing in the forefront of rallies, and talking about stopping Asian hate and, really they can't burn us all, and those are campaigns that really were Asian older adults taking the forefront. So I think there's a lot of wisdom that can be shared. There's a lot of resilience. There's a lot of trauma that I think people have experienced, but it really kind of ties into this idea for me as a social worker of post-traumatic growth, that there's a lot of wisdom that can be shared. And in fact, we're seeing this happen right now. So it's just something I kind of wanted to point out.
Thank you. And Christian, did you?
Yeah. So, yeah. Well, one thing I was curious about is that, I mean, Keith, you mentioned sort of the importance of intergenerational families in particular. I mean, it's like, and I grew up in one. My grandma lived with us for my entire childhood and took care of us, et cetera. And so, in addition to the ways that older adults are important in society more broadly, what are some other ways? I mean, it's like that older adults are contribute to a lot of the immigrant families that support. Yeah, basically, I mean, it's a contribute to the immigrant families in New York.
Sure. I think, there's always kind of the story of like, learning about the old country, right, from your grandparents. And I think there's much more of a desire right now amongst the Asian American community, the AAPI community, to really kind of understand those roots and know that those roots are somewhat different from, for example, what's currently going on in China, right? Because current conditions in China are pretty different from, like, say, the experiences of our grandparents who came to the US, right? So I think part of it is seeking this identity, seeking this wisdom, and having this intergenerational connection. And some of that knowledge is really invaluable, really something that you can't really be replaced. And I think a lot of it too is that having a sense of identity, having a sense of connection, that's really what I have been starting to gravitate towards more on, especially in the context of the pandemic, this sense of social isolation, this sense of connectedness, disconnectedness. And as you kind of talked about too, Christian, right? What are the different ingredients that go into connecting people? Part of it is the having the internet access, but part of it is also, having those relationships and having those relationships that matter, right?
So I need to honor the UN Convention on the Rights of Older Persons. Thank you, Francis. That was raised in the chat, and use that as a springboard to ask you all to turn now explicitly to a policy consideration of what you've spoken about, and talk a little bit about specific public policies that would move us toward this culture of agency that you were beginning to describe, which is, I think, what we are working toward across the life course and struggling toward, depending on our positionality in all different ways across society, including age. So let's talk about the culture of agency and what are the investments and the policy changes we need to make to create that for everybody. Anyone? We know the audience wants to weigh in on this if you guys don't.
I'll jump in if since the report that we wrote on internet access was very sort of policy focused. I mean, I think that one of the things that really came through in the pandemic is that there were huge class-based disadvantages that got magnified in the context of the pandemic, right? I mean, it's and people with jobs that were able to be done at home were able to do so, and so many. I mean, it's like that's already been written about. In the case of the of access to the internet, the people who did have access to the internet already and had the skills to be able to use them were able to use them to meet their basic needs and access telemedicine, communicate with other people. I mean, it's like they were able to mitigate or moderate their lives through the internet. But at the same time, so there's that particular aspect of it as well. But then there are others. I mean, it's like that underpin what it's like to live online versus living in person. And one of them, and this is something that Ruth and I have gone back and forth about a lot, is that for most internet shopping, or for all internet shopping, you need a credit card or a bank account. I mean, it's like, or some other way of, being able to pay when you can't sort of send cash. I mean, it's like through the internet. And so not only is it a barrier to online life to not have a connection and not be able to use the internet, but also, I mean, it's like something that's a barrier outside in real life as well, which is being unbanked, is something that is a double barrier when you're mediating your life online, so that's just another, sort of example of that. And so the fact is, I mean, it's like that the pandemic has really highlighted that for people. I mean, it's like exactly where these things come from. But the fact is that without the education and the skills to be able to use the internet and to overcome those barriers, you're left with a problem without a solution for thousands of older adults. And so in a sense, I mean, it's while in-person life has been able to create a lot more agency for people, if they're able to find a workaround, being locked at home, I mean, it's like really showed that if you don't have a plan B or a plan C, in this case, I mean, it's like involving, I mean, it's like being able to get online, life is that much more difficult, and it sort of highlights that lack of agency and how quickly somebody can go from thinking that they live an independent life to suddenly being rendered vulnerable, in essence, by having all other options cut off.
Does anyone else want to speak specifically into the policy arena, the public policy arena?
I will. One thing that's really struck me about the COVID pandemic is how much it resembles the HIV pandemic in terms of affecting vulnerable populations and vulnerable communities. If you take a zip code map of New York City of people with HIV and overlay it with a map of people with COVID, it's almost a one-to-one match. And these communities are the poor, vulnerable communities largely populated by people of color. And the underlying driver behind both of these things is lack of economic access and opportunities over the life course. And it's very simple, but I think in large ways it comes down to the money and people being able to make a living wage and not have to work 3 part-time jobs, having decent insurance. All of that economic factor unlocks so much else in terms of, not having to have 10 people living in a small apartment because you can't afford anymore, and then, increasing the risk there. And it just multiplies. And I really think there's been a lot of policy ideas about how we do that in terms of increasing the minimum wage for one. But I think that's really key when we move forward as a society, and of course are going to experience something like this again at some point in the future. This could be the opportunity for us to break out of that as we start to put things back together.
I also want to chime in with the issue, another issue about work. It's, I know it's frustrating to the participants that I keep referring to the Q&A, and you can't see it, certainly not the A's, but we'll post this when we post the session. But a number of you have spoken inspiringly about your own work. My favorite comment being the 80-year-old who's going to be paying off student loans until you're 85. This is not, I'm I'm not enjoying this because you're paying off student loans. I'm enjoying this because it's a demonstration of the vitality that we bring to our work. There's also been other people speaking about work, and of course, issues about different opportunities to work, to stay in work, to work as work switches, the balance from remote to in person, to what technological capacity is required to do work, all requires public policy intervention to allow older workers, but also other workers who have specific patterns of discrimination, which is gendered and which is based on color, incredibly, to be more actively addressed in public policy than it is, and for companies and the government to be more closely monitored and expected to eradicate patterns of discrimination, which we know is only the beginning to full opportunity, but without employment, it becomes really quite impossible. Are there other, so that was my final word. Do others of you want to give final words before we close? We're not going to keep people here late. Come on, have a benediction, do it. You know you all want to. Here, put your hands up, do the benediction thing. Oh, they're holding back. Okay, great. Thank you so much. And we look forward to seeing you very soon in person.